Hello, my name is Hope. I am currently a PGY4 doing my emergency medicine in Edmonton, and I did my third year of medical training in Prince Albert, Saskatchewan.
I'm Sophie McBean. I am currently a fourth year pediatric resident out of the Northern Ontario School of Medicine University, which is in Northern Ontario. I've been doing my pediatrics training. I'm originally from Saskatoon and did all of my med school at UMS and got the wonderful opportunity to do my third year of medical school through the Prince Albert program.
I think the most valuable thing about doing third year clerkship in Prince Albert is the tailored learning experience to each learner. There's so many fewer medical students that all of the staff there get to know you a little bit. They get to know your interests, the areas where you need improvement, and they really work at bringing you along as a medical student and helping you reach your own goals.
There's so many things, but I think the number one thing, which hopefully is already being talked about with you guys already, is that in Prince Albert, because there's only a small group of clerks and then a small group of family med residents, you get so much opportunity for hands-on, one-on-one with staff and independent learning. So if that's the way that you like to learn, by seeing patients yourself, working up patients yourself, having your hands on the patient alongside supportive staff, Prince Albert is a place for you.
The most important lesson that I learned in Prince Albert is that it's important to challenge yourself and step out of your comfort zone, while also understanding that there's always help available and you can always ask for help. Now, as a senior emergency medicine resident, I've been learning that more and more through my residency training, that you're never too senior or know too much to ask for help. And most of the time you're going to benefit from asking your colleagues for help. And in Prince Albert, they really challenge you to push yourself, step out of your comfort zone as a medical student, manage patients and events as much as you can, but to know that you have help available. You can always call for help.
I think one is like about responsibility of patient care. So, when you're outside of a large team, outside of a tertiary center, you recognize that even without those big systems in place, you still need to look at the patient that's in front of you and assess and make up a plan for them outside of the large tertiary center. There's a lot of care that is going on outside of those big teams, and I feel like you don't really get a sense of responsibility a lot in medical school in a bigger center, and you usually get it a little bit more in residency. But being in Prince Albert, it's like, wow, okay, we really need to make a plan for this person. We have these staff members who are outside of the big tertiary center, outside of the big teams, who are making plans, and you get to be at the forefront of that planning with the patient in front of you, using your clinical assessment rather than relying on various other subspecialty teams or fancy investigations that might be available.
Prince Albert has specialty trained anesthesia, general surgery, internal medicine physicians who specialize in intensive care, +1 emergency medicine, as well as emergency physicians who have challenged their exam. Some of the best emergency doctors that I have worked with to this day who did their training in South Africa. And now that I have been to South Africa myself and did a trauma elective there as a resident, I can tell you exactly why those physicians are so incredible. There is nothing that they haven't seen. And so I think that that's really important for people to keep in mind, that you can go there and get maybe even better specialized training than you might get in Saskatoon or Regina, because you get so much hands-on experience.
As some of you guys may or may not know, Prince Albert, you still do 6 weeks of subspecialty rotation. You still do core rotations. So I did 6 weeks of obstetrics, I did 6 weeks of general surgery, I did 6 weeks of anesthesia, again, kind of one-on-one with the staff. So I would say that my subspecialty exposure was immense because you're constantly working with the subspecialists directly rather than with a bunch of other medical students or a bunch of other residents around. I always kind of thought that I wanted to do pediatrics going into medical school. And so then being out in Prince Albert and seeing the wide array of pediatrics in Prince Albert, whether that be through the neonatology unit or through the emergency department or through the clinic or through a pediatric inpatient ward. I really got to see it all, which I think is different than sometimes being on a ped service and just doing CTU. It's like I got to do NICU, recess, emerge consults, everything all together. So I think by having that exposure to the subspecialties in Prince Albert without any of those limitations of being like, you're on CTU for these 4 weeks or you're on NICU for these 4 weeks, I really got to see the breadth of what the subspecialties do.
I went back because PA means so much to me. When you're there as a med student, you really get to know the staff, they get to know you. When I matched to Emerge, all of the Emerge staff there were so excited for me and really encouraging, and also really wanted me to come back and see what it's like there now. And so, yeah, I went back. It was an absolute blast to be there as a senior resident and to show them how much I have learned and how much I have grown. And obviously bringing a different perspective, having been in Alberta for the last 4 years. But I really went back because it's a great place to learn. And even as a senior resident, it was a fantastic learning experience.
I chose to come back to Prince Albert, because the clinical experience is amazing. You get so much variety, so much acuity, especially in pediatrics. We do NICU, peds, and outpatient clinic and phone calls from the periphery. So getting that experience, even as a 4th-year resident, is so, so valuable. And I knew that I wanted to come back. So I wanted to come back for the clinical experience. I also wanted to come back because I think I might want to maybe one day work here, because Prince Albert really made such an impression on me during my 3rd year. Also, just the people are so lovely. I was here 5 years ago as a clerk, and all the nurses still remember me and are happy to see me, are excited to have people back. So that type of environment, walking into the hospital where I haven't been here for 5 years, but I still remember everybody and everybody remembers me and we're friendly and happy. It's just the kind of environment that you want to come back to.
One moment is putting in my first chest tube as a medical student, which in a tertiary site, you probably would not have the chance to do as a medical student. Again, just because there's so many residents ahead of you that need that training and need to be able to do those skills without their staff around. So they are going to get priority over you. But in Prince Albert, because we do emergency medicine all year, and because there's so few residents and so few medical students, if those things come in on your shift and you're the only learner, you get to do it. And so I remember this patient coming in who needed a chest tube, and my staff looking at me and saying, "Do you want to do it?" And I was horrified, and at the time, in hindsight, knew very little about how to do a chest tube. But the staff was there, they walked me through every step. It went very well, and it was just one of those moments where A, I probably wouldn't have got to do it somewhere else, but B, I was nervous, I was unsure, it was absolutely out of my comfort zone, but my staff was there to walk me through it. My staff was there to encourage me and to push me to say, you know what, this is uncomfortable, but you can do it. And I did it, and it was great, and it was absolutely a pivotal moment for me to know, like, I am capable of more than I sometimes give myself credit for.
I'm not going to pick a really specific one because I feel like there's tons, but overall, it's just honestly the friendships that I had the opportunity to make. I came out here with 2 of my closer friends in medical school, so we all lived together, and we got to be roommates for the year throughout clerkship, which was really just so special to be able to build our relationship further in and out of the hospital. I became friends with quite a few of the nurses on the ward. I'm still very close friends with the pediatricians, even though I've been gone away for 5 years. And again, like walking into the hospital, even though I haven't been there for 5 years, I walk back in and everybody knows each other and is just so happy to see people coming back. So I think my absolute favorite memory is just the people that I've met, the relationships that I made, even in a small town. It's really like lifelong and lasting and impactful, and really important to have those relationships and supportive people around you in and outside of the hospital during your 3rd year clerkship, which is your first year really in the hospital system. So definitely the people are my favorite memory and my favorite thing about Prince Albert overall, without being too specific.